This is an example of a labral tear. This is my probe pulling up the tear. Here we've already prepared the acetabulum on the back, so we're using this instrument to repair the labrum. We'll put one suture underneath the labrum, one suture through the labrum in order to get a base suture without irritating the cartilage on the femoral head as it rubs against it. So we'll take a drill a hole into the bone, then I'll take our anchor device, which is attached to the suture, and then anchor it into the bone that repairs the labrum back to the bone for later healing. Again, we're repeating the step, grabbing the suture, pulling it through the labrum, not around the labrum, to better approximate the labrum to the socket without pulling it away from the socket, and also preventing scratching of the femoral head later on. This is the third anchor we're putting in, the third of 3 for this patient, and again, repeating the same steps. So at this point, take our probe, make sure we have good approximation of the labrum without any lifting of the labrum and the cartilaginous tissue. Patient does have a little bit of rim of cartilage damage across the top of the hip, which is oftentimes the case with these labral tears. Here you can see we got an excellent repair.